there's just so much.
You're listening to a Mamma Mia podcast.
This episode discusses general health and wellness information only and does not replace personalised medical advice. Always speak with your GP or qualified health professional before starting supplements, testing, treatments, or changing prescribed medication. Welcome to Well, Your Health and Body Explained. I'm Grace Rouvray.
And I'm Dr Mariam.
And today we're getting into the gut and skin connection. Now, a gut-skin connection that I had was perioral dermatitis from pregnancy, and it hung around for about 4 months of postpartum, and a nutritionist told me to take a probiotic to fix it. Mariam, can you explain what that probiotic in theory would have been doing to my skin?
So just for anyone who hasn't experienced PD, which is perioral dermatitis, lucky you, it's this stubborn, angry little rash that clusters around your mouth and chin. Was that similar for you? Around your mouth and chin? Sometimes your nose, and it looks a bit like acne, but it's not acne. And if you treat it like acne, it will make it significantly worse.
Yes, or pash. It looks a bit like pash rash.
Yeah,
even.
It does, doesn't it? It can be red, it can be bumpy, it can be scaly, and it absolutely does not know when it's not welcome. Postpartum is the perfect storm for it because your hormones have just fallen off a cliff. Your immune system has completely reorganized and your microbiome has shifted and your skin feels all of it. So this is where probiotics come into play. What do they actually do? Because the word probiotic is everywhere. So your gut contains trillions, so like trillions of these microorganisms. That's your microbiome, and it's this community that is actively communicating with your immune system, your brain, and your skin. So we call it the gut-skin axis. It's established science, I promise. It's not an Instagram trend or an invention. And a probiotic introduces live beneficial bacteria. So not all bacteria is bad. There are good bacteria. And these strains, specifically Lactobacillus and Bifidobacterium, these strains restore and support that community in your gut. They strengthen that gut lining. They compete with the bad bacteria, and they modulate the immune response. And that last part is directly relevant to inflammatory skin conditions like PD. And the evidence here is generally promising. So certain strains like the Lactobacillus strains have been shown to reduce inflammatory markers and support skin barrier function. But strain specifically matters enormously. So not all probiotics are equal, and grabbing whatever's on special at the chemist is not quite the same as targeted recommendation. So nutritionist wasn't wrong, but have a chat with your GP or a dietitian about what specific strain is actually evidence-based for your presentation.
Would a dermatologist help, or a skincare specialist?
Yeah, definitely. Yeah. So dermatologist, dietitian, GP, just ask about what specific strain you need.
Are there GPs that do specialise in like skin and dermatology as well?
Yeah, there are skin-based GPs as well. There are like one of my colleagues that I work with, he essentially just does skin, and he's fantastic, does a lot of skin cancer stuff and things like that. Yeah. And you kind of refer when it's just beyond your level of expertise.
Because it's hard to cut through the noise of the amount of products there are. And around this time where I had this perioral dermatitis, even my socials knew that I'd looked it up, and it was telling me products that were specific for perioral dermatitis. So it's hard to know what is the most effective treatment option.
Yeah. And then when you kind of go down that rabbit hole and you're getting fed all this information, you like a lot of patients that I see will have spent like an arm and a leg before they've come to see me. So if you do and you are experiencing, you've tried a simple remedy not working, just go to a doctor, get a personalised care for you. You might get like a PBS prescription medicine that clears it all and fantastic, rather than having spent the arm and leg that social media has taken you on,
Well, we're going to get more into that with a gut and skin doctor, Victoria Pavasovic. But first, we're going to talk about adult sleep training. We're going to med school.
Welcome to med school.
First, Mariam, where are you at when it comes to sleep training a baby?
Look, I'm not going to pretend I have this one figured out. I'm a GP who knows the evidence, but I'm still up every couple of hours wondering how people do this. And I say that's someone who knows the evidence, but the framework I keep coming back to personally and clinically, I don't know if you've heard of the POSSUMS NDC approach. So neuroprotective developmental care. It's developed by an Australian doctor called Dr Pamela Douglas. And what I love about it is it completely reframes the conversation and the pressure that a lot of mums feel. It works with your baby's neurobiology rather than against it. So night waking is not a problem to be fixed. There's not something wrong with your baby. It's developmentally normal. A newborn brain is literally wired to seek proximity and wake frequently. That's evolution doing exactly what it's supposed to do. The possum's approach focuses on daytime rhythms, responsive settling, and crucially, what I love about it is it focuses on the mother's well-being as central to the whole picture. Because when mum is well, everything is well. But do I have this perfectly implemented at 3 a.m. like I did, this morning? Absolutely not. Knowing the science and living the science are two different things. But where I'm at with sleep training, I'm non-judgmental. It's about whatever gets families through the night safely. Rested is rested, surviving is surviving. Yeah.
So there is a trend that the internet and then maybe the medical community has gotten behind, sleep training for adults. So if someone comes to you and says, I'm not sleeping, at what point are you going, this is insomnia? Like, what are the stages before a diagnosis of insomnia? What clinical tests would you do?
Yeah, so there are questionnaires that we can do, but I also want to see whether this is all just purely lifestyle or stress related. For some people, there's, we've got a lot of shift workers, or, people are like chugging caffeine right before bed. There's a lot of stress related causes or mental health conditions. So it's kind of filtering through that and making sure that this isn't a pathological cause or that there's a reason for the insomnia. And then there is something called CBTI. So if we do diagnose insomnia, something that is so underutilized. And it's unfortunate because I have so many patients who are like, I've had trouble sleeping for years and I've seen a doctor and they've just given me a script for this medication. And then they've been on this medication, which has addictive properties for a long time, and they haven't really kind of gotten to the core of the issue. So there's something called CBTI, which is first line for insomnia. It's cognitive behavioral therapy for insomnia. Their access to it has improved dramatically over the year. You can actually do it online and it works. It is effective. You just have to kind of really sit down and do it. And it is the first line treatment before medications, before doing anything or, an easy pill. This is the work that people generally need to do, cognitive behavioral therapy, CBTI. So if you feel like you have insomnia, see your GP, let them know you've been having trouble sleeping. Sleep hygiene is massive. I'm not sure if you've heard of things, but it's like the bedroom is for the bed.
It's for sleep and sex only.
Sleep and sex only. Yes, sex is your thing. Fantastic.
What is sex?
I'm postpartum.
But I have been run through the sleep hygiene things, and it's don't take your phone to bed. Yeah. Don't look at your phone for an hour.
And it's about, some people do a bit of meditation, winding down, lights off before bed, creating that environment, implementing those practices. And then if you're waking up frequently through the night, trying not to grab the phone or doing that countdown to the morning. So there's all these things that you can do. And if that's not working, definitely see your GP, get that referral for CBTI. It definitely can change lives.
I'm Kate Langbrook and I host No Filter. Celeste Barber.
Hi.
Welcome to No Filter.
It's nice to be here.
Yeah, today we're diving into the world of G-Flip.
And your voice has always been such a calming, warm energy. So that's why I tear up, because you're always growing up with you around. So thank you.
Sally Hepworth, what a absolute jewel you are in the crown of artists.
Oh, thank you. This has been lovely.
Today, we're talking to Rosie O'Donnell.
I just want to tell you, this is one of the best interviews I've ever had.
If you love conversations that go deep and stories that stay with you, listen to No Filter. New episodes of No Filter drop every Monday, wherever you get your podcasts.
We're obsessed with our skin. From expensive serums to the latest viral treatments, we're constantly searching for ways to keep it healthy, glowing, and, of course, ageless. But what if the answer isn't sitting on your bathroom shelf? What if the health of your skin actually starts somewhere much deeper?
People get referred into me with skin rashes, and often the last thing I will do is touch the skin. And I'll explain to them about how the skin is a language, and that language is screaming something at you, and we have to actually explore what is it saying. And often that involves a very deep dive into the internal dynamics of how they eat, but also how their gut is functioning.
Victoria Pavasovic is a functional medicine practitioner specialising in the microbiome, skin and hair health. When treating skin conditions, she focuses on the internal relationship between our organs.
We know there's also a gut-skin connection, and there's a gut-heart connection and a gut-lung connection and a gut-endometrial connection. So this superhighway of connection is becoming increasingly powerful as we learn more about it. And the mode of connection is via the vagus nerve, through your whole body and down through the diaphragm, and innervates the connection between the gut and the brain and all those other organs.
The idea that our gut can affect our skin might sound surprising, but growing research suggests that the two are closely connected. Victoria explains that a large portion of the body's immune system is housed in the gut lining, which acts as a key defence barrier. When that lining becomes inflamed or disrupted, it can send strong signals through the body, contributing to a range of symptoms. For some people, that might appear as joint pain, fatigue, or weight changes. For many women, it can also show up more visibly as ongoing skin issues, like hormonal acne or rosacea, often alongside gut symptoms and changes in mood or mental well-being.
Depending on which science paper you read or which textbook you refer to, there is somewhere between 70 to 80% of your whole body's immunity that is based within the gut. So the gut wall is lined with immunoglobulin cells, and that's a very important part of your immune system, the system that's there to defend us from invasion and from becoming unwell. If that intestinal wall becomes inflamed, it releases very loud and high volume signals to the rest of the body.
This cold plunge is freezing my gains. Studies show that cold exposure
helps with an infrared sauna, hands breaking
Here's
down.
my superhuman bone broth to improve your energy, physique, skin and hair.
And while social media is full of wellness trends, from infrared saunas and cold plunges to expensive NAD therapies, Victoria says many people are overlooking the basics that have the biggest impact on their health. She says that one of the most common mistakes that people make is cutting back on carbohydrates and sugar without properly replacing that energy with enough protein and healthy fats. When the body isn't getting the fuel it needs, energy levels can drop, leaving people feeling tired, irritable, and constantly hungry despite their best efforts to eat healthy.
Here are the areas that I think people make mistakes. When you fuel your body, there are three main types of fuel. There is protein, there is fat, and there is carbohydrate. And most people, unless you live under a rock, would know now that high glycemic carbohydrates and sugars actually are quite inflammatory, so they're best not to have in large amounts. So people are taking away the carbs and they're taking away the sugars, but they're actually not increasing their healthy fat and their protein. And if you take the carb away, your little mitochondria, your little battery pack in every cell, is going to start screaming for energy.
Victoria encourages a balanced diet. She teaches her patients to think about a few key building blocks at every meal: fibre-rich vegetables, antioxidant-packed foods such as berries, and healthy fats, including omega-3s. These nutrients play an important role in supporting overall health and helping the skin maintain a strong, healthy barrier.
So when you're making your salad, don't just use an orange carrot, use a yellow or a red carrot as well. Capsicum, use all the colours of the capsicum. In regards to the skin loves healthy fat. So fatty fish, omega-3 oils, extra virgin olive oil. It also loves polyphenols. So they are your fruits, but particularly your berries. These are high antioxidant foods.
Hydration has also become a major wellness trend, with many influencers claiming that drinking litres of water each day is the key to glowing skin. But Victoria says it's not quite that simple. While staying hydrated is important, she explains that drinking excessive amounts of water without paying attention to the electrolyte balance can sometimes leave people feeling fatigued, foggy, or run down. Her advice is to focus on overall hydration and mineral balance, rather than simply trying to drink as much water as possible.
If you drink litres and litres of water a day without electrolytes, you will hemodilute. So what that means is the proportion of free water versus electrolyte in your blood will be high. And that could have some consequences. You could get salt depleted. You might start to get muscle aches and pains or a bit brain foggy. So 2 litres of water a day is a good level for most people, unless you've got a cardiovascular disease and you've been told to restrict your fluids. Water it's one of those daily habits which we shouldn't even have to think about, but it can make a big difference to how hydrated and nourished your skin is.
It's a reminder that healthy skin isn't just about what we avoid. It's also about making sure the body has the nutrients it needs to function well. Victoria says our focus on quick cosmetic fixes can sometimes lead to overtreated skin, particularly when people are encouraged to undergo multiple intensive treatments in a short period of time. She explains that the skin has its own protective barrier and microbiome, both of which can be disrupted by excessive intervention.
Don't overtreat the skin. I see some very overtreated skin, particularly brides who've been treated every week with hydrofacials and all sorts of lasers, and they come in and their skin's really red. So think of this. The skin has a life cycle, the skin cell, of about 4 to 5 weeks. So if you're treating the skin, if you're lasering it or if you're doing a collagen induction treatment, you want to allow those skin cells to rest and repair for at least 4 or 5 weeks until you hit it again. And in your skincare regime, keep it simple. Keep it really simple. Don't foam with a cleanser. Be mindful that there is an acid mantle on the outer layer. So if you over-process, you can disrupt the acid mantle and your lovely skin biome.
So before you reach for the next trending treatment or add another product to your bathroom shelf, Victoria suggests zooming out. She encourages people to get back to the foundations first, supporting gut health, nourishing the microbiome, eating a balanced diet, and keeping skincare routines simple and consistent. Because if skin issues are just the surface symptom, what's really happening underneath that you're missing?
The doctor will see you now, just through here to consult room 1.
All right, we're going to the quick consult, and Jessica has a question on reflux. This is what Jessica said. Why do I often have reflux? Is it caused by certain foods or something else? I have been given medication from my doctor, but I want to know what it causes so I don't have to take the medication. I'm 42 and have gluten sensitivity, and that has developed in the last few years, and wonder if that is connected as well.
Yeah, so reflux happens, you've got this valve between your esophagus and your stomach, and you've got this little sphincter which stops the food coming from the stomach back up to the esophagus. If that doesn't close properly, the stomach acid, so all that acid that your stomach produces to break down the food, it creeps back up and you get that kind of burning sensation, that discomfort after meals. Some people even have a cough or a sore throat. Lifestyle triggers are the obvious starting point. So common causes are fatty or fried foods, too much caffeine, alcohol, chocolate, citrus type foods, large meals close to bedtime. So if you're thinking having a big feed and then you're lying flat, and smoking as well, they all directly relax that valve and that ramps up the acid production as well. Weight is another driver of reflux. So the rising prevalence of gastroesophageal reflux disease in Australia, also known as GORD, is most likely due to obesity. So you're thinking about a lot of weight around the abdomen, anything that increases that pressure on the stomach pushes the acid upwards. And you can also get something called a hiatus hernia. So that's a little hernia that forms near the stomach, and part of the stomach can shift up through the diaphragm, and that can disrupt the valve there as well. That's very common and often found incidentally, worth knowing about. Medications also are underappreciated. So a lot of people take over-the-counter medications without knowing what side effect profiles. So think of things like ibuprofen, some blood pressure medications, a lot of GLP-1 medications as well. The side effects can be reflux. Certain antidepressants, they can all contribute. So always worth reviewing your full medication list with your GP to see if that's contributing. Stress and anxiety. Gut-brain connection is real. So stress can also increase acid production, lowers the threshold for how sensitive your esophagus feels. If life is chaotic and your reflux is flaring, that is not a coincidence. And then one thing I want to speak about, because I diagnose this condition every week. So I'm not sure if you're familiar with something called Helicobacter pylori.
Absolutely
not.
It's
a very common bacterial infection in the stomach lining. It causes inflammation of the stomach, so gastritis, and overlapping symptoms like reflux. Easily tested for, easily treated. So if someone is positive, I get the whole family tested or whoever they live with, because it can be found in households. Worth asking about if you've never been checked for it. On your gluten sensitivity question, gut inflammation from that can absolutely overlap with reflux symptoms. It's worth asking your GP whether a full celiac testing panel has been done. If it hasn't, definitely get that tested. Now, the part I really want people to hear about, because I'm always about red flags. So persistent worsening or changing reflux needs to be properly investigated. So chronic GORD increases the risk of esophageal cancer or adenocarcinoma fivefold compared to the general population via a condition called Barrett's esophagus. So red flags are if you're having difficulty swallowing, unexplained weight loss, vomiting, or reflux that isn't responding to treatment. Don't sit on those. Go back to your GP, and if your symptoms are ongoing despite treatment, ask for a referral to a gastroenterologist. An endoscopy, which is just a camera down into the esophagus and stomach, can give us a clear picture of what's actually happening, and that's peace of mind worth knowing about.
So some of the treatments, like the over-the-counter ones, like the lozenge things that you suck on, is that a Band-Aid or is that
it is definitely a Band-Aid. So I'd want to know why the reflux is happening in the first place. So kind of going through why is this happening, and if anything I've mentioned is like, we always start with lifestyle changes alongside treatment. And then if it's persisting despite that, then that warrants further investigation. And please don't just stop your medication without talking to your doctor first. So stopping PPIs, which are called protein pump inhibitors, that can actually cause a rebound flare. We know that weight loss has the strongest evidence for helping reflux symptoms alongside cutting trigger foods, not eating close to bed, and quitting smoking if you're smoking, reducing alcohol intake. Many people can reduce or come off those medications altogether, but do it in partnership with your GP, not alone, and make sure you're being investigated for any of those other background things which may have been missed.
As always, you're a wealth of knowledge, Mariam.
Yeah, well, reflux is very common. I see patients for reflux multiple times a day. Yeah.
Multiple times a day.
Yeah. Did you get reflux during pregnancy, by the way? Yeah.
Yes.
Everything goes back to pregnancy.
Everything, again, poor women. That's how we end. Thank you so much for listening to this episode of Well. As always, head to our socials where we have all these little tidbits of information about women's health. And you can also go to Apple Podcasts or Spotify and give us a review.
Give us a 5-star review. Yeah. Or just don't go there.
A 5-star or nothing. Thank you so much. We'll be back in your ears next week.
Bye-bye.
Mamamia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wonnarua people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.